Again, welcome people to we're going to be starting in about 1 minute. If you have any question, or if there's any questions that you want to ask or you want us to cover, don't hesitate to shoot them out. And we will do our best to hopefully be able to answer them in the, during the chat. Again, I can repeat some practical information if you have joined from a web browser and want to have the full experience of being able to participate in polls or questions. I suggest you rejoin and download the Zoom app. And now it is 5 o'clock and let's get started. So hi everybody, and a warm welcome to War on Cancer's first ever live webinar. This is going to be 30 minutes in total, and the topic for today's conversation will be how to cope with cancer from a mental health point of view. And with us today, we have Dag Härdfeldt. So Dag is a licensed psychologist, and he works for the app doctor called KRY, which is the Swedish name, or LIVI, which is the UK or international name. He worked there as a therapist, a digital therapist, and just for your information, KRY has only enabled the therapy feature in Sweden and France so far. KRY, Dag is also works in the primary care and has extensive experience with treating newly diagnosed patients. And some practical information, if you have joined today from the web browser, joined this webinar by the web browser, you can do that, and of course you'll be able to watch the whole webinar. However, if you want to participate in polls, answer questions, and these type of things, I suggest that you rejoin the webinar and download the Zoom app. And before jumping into the conversation and sort of start talking about these topics, shortly about myself and who I am. So my name is Fabian Bolin. I'm the co-founder of the War on Cancer app. I'm a cancer patient myself. I was diagnosed with leukemia, which is blood cancer, about 5 years ago. I was treated for about 2.5 years of those, and I'm now coming up towards being declared officially cured later this autumn, which is a wonderful experience. And my experience with going through cancer treatment was very much an up and down type of situation when it comes to mental health. I experienced this almost like a roller coaster with some surprisingly large highs, but also some really deep lows. And I think I'm certain I touched upon depression a couple of times. So mental health is something, and cancer is something that is really dear to myself and to the company War on Cancer. And this is the whole reason why we set out to build War on Cancer, to provide people with a platform where they can actually deal with their mental health. And with that said, let's get started with today's topics. And we want to really continue this ongoing conversation we have on mental health and cancer. And before, we have lined up a couple of questions that we're going to try and cover throughout this chat. So first of all, does cancer affect your mental health? And if so, how? And then secondly, what is the procedure that I can experience as a patient if I go to see a therapist? And thirdly, go into some coping strategies, and fourthly, we'll talk about whether everybody needs a therapist or not. And then some of you have sent a bunch of questions already before this webinar, and we promise to answer all of them towards the end of the chat. But now let's start with the topics, and I guess first of all, welcome, Dag.
Thank you, Fabian.
How's your day been so far?
My day has been very good so far. Thank you for asking. And thank you for allowing me to come back and be part of this war you, your team, and all the users are waging against cancer. So with that said, we have a limited bit of time. So
let's get started with the first question. I mean, so very generally speaking, does cancer affect your mental health? And if so, how?
Absolutely. Before I will begin, I just need to make a small clarification regarding some terms I will be using.
Yep.
Today I will be using the word therapist and the counselor a lot, and what I really mean by these terms is basically any kind of healthcare professional that is trained in performing therapy, not just psychologists. So this can also be a social worker or a nurse with a specialized degree, psychiatrist or a doctor. And I will probably slip up and use the term psychologist anyway, because I use it so often. But throughout the whole conversation, I'm always referring to healthcare workers that perform therapy. And by that, I mean, it's just not a psychologist who can give you these tools that we will go through today. With that said, regarding the question, do cancer affect your mental health? The simple part of that answer is yes, absolutely. It affects our mental health without a shadow of a doubt. I think in general for cancer patient, it is about 3 times as likely to experience depression and anxiety disorders in relation to the general population. But the complicated part is how it affects us.
Yeah.
And I think the reason it's so complicated is because you can't really speak about cancer as if it were just one problem, one type of disease. Cancer, it's more effective to talk about it as a sort of attack on the body that comes from within. And depending on where this attack strikes, how hard it hits, and how your defense is set up, your mind will be affected in a vast variety of different ways.
Yeah.
So what I'm trying to convey here is that there is no clear-cut way to predict how cancer will affect you. Like in the same way I can predict depression will give you certain kind of symptoms.
Understood.
Yeah, no, continue.
I'm just sort of you might come to that in your.
And please do, Fabian, because if I am unclear or something, please do interrupt me and ask me to elaborate upon it.
Yeah, but I mean, are there some sort of general? I mean, we've looked at some research. For instance, there's some research pointing towards that 25% of cancer patients get PTSD within the first 6 months, and that 22% get PTSD, and the 25% get clinical depression. Is that something that you've heard as well, or you encountered in your work?
Yeah, I think you got those numbers right. That's when I said it's like 3 times more likely to experience depression. I think for the general population, the number is like 9%. Yeah. So, and there is even more nuanced research upon how different kinds of cancer results in different primary psychological problems. For instance, I read that in lung cancer, the disturbances in the mood could best be predicted by the amount of physical impairment that the cancer created. But when it comes to breast cancer, fear of intimacy was more prominent. And when it comes to skin cancer, the primary cause of distress was related to body satisfaction.
Yeah.
Do you recognize these findings as well?
I have not read them, no. So this is new information for me. And I mean, when you're explaining it sounds very plausible. Obviously, with the characteristics of the different forms of cancer you just mentioned.
Yes, and this is something we will come to this a bit later, because I think understanding the type of cancer you have and understanding who you are as a person is very important for you in order to determine how this will affect you and how you best shall fight it.
Yeah.
So to summarize, there is no such thing as a clear causality between you get cancer and this happens to you. What happens is a complex interaction between what you as a person value in your life, what you lose due to the cancer, how much of it you will lose, and finally but maybe most importantly, how you as a person manage that loss.
Yeah. Well, I think that kind of explains that it's a great first answer. And I would like to know sort of, we're going to cover this later on, but do some people get completely spared from a mental health point of view? I mean, you said that everybody gets affected from a mental health point of view, but are there some people that can go through a cancer diagnosis completely just, you know, as if nothing happened on a mental health level?
That's it's a very good question, Fabian. I think the common denominator of everybody who suffers cancer, I would say, lies in this term I used, the loss. You lose something. And allow me to elaborate a bit on that. It is my firm belief, and speaking from my own experience, is that every form of cancer results in some kind of loss. It can be a big, a small, a barely notable loss, but it's there.
Yeah.
It can be a loss of physical comfort, a loss of physical mobility, a loss of opportunities, a loss of income, a loss of freedom, a loss of plans for the future, physical strength, energy. You might not be able to perform things as well as you used to. And even if all those things are intact, it is still a loss of calm and peace inside. Yeah. A loss of the certainty that everything will be all right. A loss of like a carefree life.
Yeah.
It doesn't have to be a permanent loss. It is a loss that can be repaid even with interest, like when you experience post-traumatic growth. Kind of what you have described, Fabian. But I haven't come across one patient with cancer that hasn't described some kind of loss, even if it was just a minor thing. But this is all secondhand information. Like, I haven't experienced it myself.
No.
So I can't know for sure. But sure. What do you say, Fabian? Like, when you received your diagnosis, did you experience some kind of loss in some kind of way? And if so, what did you feel that you lose?
Loads of things. My career, my physical strength, my friends, who some of them just vanished, and sort of like, I felt that I lost my path. I felt that I was on a trajectory towards somewhere, and that completely, I can totally relate to what you're saying about losing things. And I think it's fair to say that, you know, however you're affected, life is going to change for you when you're diagnosed with cancer, and you will be losing things. And I'd love to pick you up on that topic on post-traumatic growth later on, but before I would like to actually, before we continue, I'd like to send out a question, the first poll that we have, which relates to getting help with the mental health. So the poll is, in essence, have you used a therapist? And if everybody that is watching the webinar can just answer, this is really interesting. Take a couple of seconds. 7 yes, 2 no so far. So we have, yeah, I think you can see it as well, Dag.
Yes, I see them all.
Yeah, I'm glad to see that so many have experienced. This is not something that I was offered when I was going through cancer myself. So let's end it there. And we have 73% of the viewers said yes, and 27% said no. And I mean, I think this is a really interesting, especially for the people that haven't been to a therapist in connection to their cancer treatment. So imagine that, can you just walk, for people that are unfamiliar with the process, what happens when I, as a cancer patient, come to you? What do you do? How do you analyze who you have in front of you? And how do you present the plan of action for this person you're talking to?
Yeah, I'm glad that you open up that topic, because I think it's that might be one of the reasons why not everybody seek out help, because therapists hasn't made it clear what psychological treatment of cancer entails. But I would, okay, like if I tell it like this, there is no such thing per se as a treatment for coping with cancer. And even though I can't speak for all the world's counselors and therapists, what will probably happen if you decide to seek out professional help is that the therapist will first and foremost try to understand what is important to you in your life. What kind of losses have you suffered and how have you been coping with it so far?
Yeah.
And then the two of you together will decide upon what can be a wide variety of topics that might help improve your situation. The therapy can be about helping you improve your skills regarding handling stress and worry. It can be about building up a tolerance for uncertainty, because I believe that living with uncertainty is unfortunately a must when you have cancer. It can be about creating a safe space where you're allowed to pour out your worst fear regarding the diagnosis and then leave those fears by the door when the therapy is over, so you can focus on other things between sessions.
Yeah.
It can be about finding out how you still can keep in touch with the things you love, even if you can't perform them in the same manners as you used to.
Yeah.
Or how you want to handle the situation with your family and friends. It can be about training you to be more assertive in dealing with doctors and other professions that you are suddenly dependent on. And it doesn't even have to be about coping with negative things. For some people in certain situations, they want to make it about self-growth, about improvement, about achieving this, what you call post-traumatic growth.
Yeah.
Or even in the very worst cases, it can be about acceptance, about being able to let go of plans you had that will never come to fruition, and replace those with new plans that still feel meaningful. And you do absolutely not have to figure it out beforehand. Like the first line of work with a therapist can be about discovering what you want the therapy to be about.
Yeah. And it's, this is really interesting. And this is really, I mean, I can see how there's a sort of wide range of tools that you can apply based on who you're meeting. But would you say, I mean, and I'd love to sort of talk to you about this more. And now we have another poll that we're going to send out, which revolves around sort of different coping strategies that we have identified. But now that I'm hearing you, it feels like there's so much more. But these are some coping strategies that we have identified as good things for someone currently going through cancer or experiencing a trauma. So it's going to be interesting to see what people answer. Journaling, therapy, support group. Oh, interesting to see that. Physical exercise. A lot of people have used exercise. So exercise and therapy together with journaling are the winners here. Thank you for answering, everybody. And yeah, I'll share the results quickly. And so this is what I wanted to come to you. So are there some, even though it seems like it's going to be quite an individualized experience for your patients, but are there some general sort of like broad coping strategies that you know is going to work for, or can you possibly comment on these, the results, and also are there some general kind of broader coping strategies that you can just recommend everybody to do that currently go through cancer or that have gone through cancer?
Yes, okay. Let's, if I can, let's start with this poll here.
Yeah.
And I'm happy to see that you posted this poll, because it kind of brings us to the final questions, which is like, do everybody need a therapist? Does we need it? And my answer there is not necessarily, maybe, because a therapist is by no means a requirement to achieve any of the things that I just mentioned. Some people prefer handling all of these topics with close one, with friends or family. Some people prefer handling these things by themselves, like through means of journaling, internal monologues, or educating themselves with self-help books. And then we even have new exciting options like this app, for instance, where we handle things together by collaborate writing and reading of each other's stories. I wish that everybody had the opportunity to be able to see a counselor if they themselves chose to.
Yeah.
But unfortunately, it's highly dependent on where you live and you're born. But I think like the main question, if you ask yourself, is, can I achieve this thing by myself, or would it help me to achieve these things with a professional?
Yeah.
So I want to go against the notion that everybody needs a therapist. I'm biased in that regard, but no, absolutely. I really think all these things are possible by yourself. Some things might be helped, like when it comes to coping with worry and management, because therapists has very well evidenced tools that we know work in order to cope with worry and such. But there is, and I get the impression here that everybody who voted on the poll seems very motivated, invested in their own coping mechanisms. And physical exercise, I'm so happy to see 9 of the 9 do that, because it's that's the main key to a lot of things.
Okay, so is that your favorite?
I would say, I would
a toolbox here, at least a general toolbox of how they can tomorrow begin to apply some of the coping mechanisms. So by Dag, which are your favorites?
Before we have, we can do it like this, because we had a couple of questions prepared.
Yeah.
And some of these general coping tips, the one I recommend that basically everybody can use, they will be mentioned in when we go through these questions. So maybe we can hit a bird in a rock with the same stone.
That makes a lot of sense. So moving into the topics that was sent to us beforehand. And the first one is, how can I best prepare my loved ones for a poor prognosis?
Well, okay. This the person who asked these questions. I think maybe I'm just speculating here, but to me it says something that this is the question you ask. To me, that says you find strength and meaning in caring for others, even in the midst of your own suffering. And maybe the knee-jerk reaction would be to advise you to focus on your own needs instead of others. And maybe that could benefit you in the long run to be less of altruistic. But I wouldn't recommend changing important values in the midst of a battle with cancer. Such thing it's a very hard and slow process, and it might be a battle better fit for another time. So now, I think you should.
Someone that cares about others, you should remain someone that cares about others.
Exactly. That's a wonderful way to put it. If that is something that gives you strength and you feel pride in that, then allow yourself to do that in the moment. Because when we are aligned with our values, that reduces stress. And the less stress we have, the better our bodies can heal.
Yeah.
But that really didn't answer the question at all. Because it's difficult, because I'm not sure if this is children involved in these loved ones that are mentioned. When it's children, it becomes a bit more complicated. But I will try to answer the question assuming we are dealing with small children.
Yeah.
So according to my own personal experience, I have found that family and loved one to people in distress, they usually appreciate to a certain degree to being allowed to participate in the battle. Usually they want to help. and constantly assuring them like, I'm fine, you shouldn't worry, how are you doing? It can have the opposite effect. So I would advise you to allow them to worry, allow them to help. Now, I know far too little about the person who asked the question to give this, so it can have a guaranteed good outcome. But can you recognize yourself in this, Fabian, the difficulty in allowing others people to help you?
Yes, I can. I'm not a person that asks for help often. And I probably should have done that more throughout my journey. I did receive a lot of help though from the community but I didn't ask for that much.
Okay, so you received.
And what I notice is that everybody wants, like loved ones, they want to be there, they want to help out. So I can definitely relate to, as long as you ask them, they're often honored to be asked to help out.
Yeah. So this is from someone who experienced from within. You would also give that advice to allow yourself to let these people in.
Yes, but this is the question was more about sort of how do I prepare my loved ones for a poor prognosis. So this is really if someone has bad news, potentially, how would you go about it? Is it straight up, or is it sort of like keep them? I think that is what the person is asking.
Okay, more about that. It's the boring answer to such a question. It really depends on the bonds between the person. But in general, I would say like this: what causes most stress when it comes to loved ones connected with people is distress. Is they usually can sense if you're not giving them the full truth. As we see it, we know it, and allowing them to live in that uncertainty, like they don't know what's going on, it usually doesn't help. So I would say, in a very broad strokes, to lay the cards on the table.
Yeah, that makes sense, and I think the truth, I think is going to be the best answer here. Moving on to the next question. Sorry for rushing, but I see that we're moving.
No, let's go.
I am worried and anxious after having my breast tumor removed, and fear that there might be cancer left in the body. How do I cope with this? So fear of relapse or fear of cancer remaining?
With this question, I think it brings us back to what we spoke about earlier about loss of control, the loss of the sense of certainty that everything is all right within you.
Yeah.
And the difficult thing about managing worry is that it's less of a hassle to fix when the worry is unfounded, such as with generalized anxiety disorder, because it's quite easy to perform experiments that can prove to the brain that your worry was unfounded. But when it comes to this case, this is a worry that is actually well-founded. There always will be a risk of recurrence.
Yeah.
So the trick when it comes to managing well-founded worry, it is not to stop worrying because A, it's impossible, and B, you should worry. It serves a purpose. The trick is to worry more effectively.
Yeah.
And that is a skill you can train. Now, unfortunately, we don't have the time to delve into the specifics how you achieve this, but this is typically such a thing that you can practice through means of cognitive behavior therapy. I can also wholeheartedly recommend the book The Worrying Cure by Robert Leahy, if I pronounced that correctly. It's a truly excellent self-help book for managing worry. I myself use a lot of strategies from it. So The Worrying Cure is very, very useful in this case.
Excellent. Thank you for that.
That, and a super quick tips if you want something. Incorporate a 15-minute worrying phase every day where you actively sit down and worry. Then during the rest of the day when these worrying thoughts occur, you can tell the brain, okay, we can worry about this, but not right now. because the brain refuses to accept when you say, don't worry about it. It doesn't work. But if you tell the brain, you can worry about this, but let's do it later, it is easier of letting go. So it's about compromising and effectivizing the way you worry.
As committing or assigning time, that was what an interesting thing. I think I can use that myself sometimes.
Yeah, it's a great tool. It works.
Right, and
yes.
last question: how to cope with a second diagnosis, relapse? I'm a metastatic cancer patient.
Okay. Thank you very much for this question, the person who answered it. Now, I am a bit hesitant to try to tackle this question with such a limited space of time. The battle with metastatic cancer can be a very tough battle, to say the least, and I think it deserves more space. But here, my recommendation would be that try to take charge of your treatment in the capacity you're capable to. With metastatic cancer, maybe sometimes the treatment in itself will play a large role in your life. And it helps if you're part of the leadership in that treatment, as opposed to just be a follower.
Yeah.
So this means, like, don't be afraid to ask questions. Don't be afraid to be a pain in the ass and not settle for unclear answers. Ask for second opinions, ask for options, discuss the specific goals of the treatment. Be involved and informed. Like, what I'm basically saying, it's not all that different from that old cliche, the serenity prayer, where grant me serenity to accept the things I cannot change and courage to change the things I can. It is a cliche, but it's very relevant. Focus your strength into the things that are susceptible to change, such as your treatment. Don't let other people decide for you what happens. So that's just assume agency and control over a process that will maybe play a large part in your life.
What about the people that don't have the energy to do that? Because as I'm sure you're aware, a lot of people are fighting severe fatigue. And just this idea of taking control might seem impossible for some people.
And in those cases, I would say metastatic cancer is not a battle that should be fought alone. It really isn't. And in those cases, if you had opportunity, I would really recommend you either seek out a loved one or professional help, because they can help you with these things. I myself, part of the job is formulating, helping the patients formulate what needs to be done.
Yeah.
So the general case is like, don't fight that battle alone. Really have your husband with you, with the doctors who can, or your wife. Yeah. So fight. So recruit your troops, I would say.
I like that. It's very actionable. But
yes.
Thank you for that answer. I think it's really, with a little help from friends or have people around you to help you, I think it summarizes this first chat that we've had greatly, or at least finishes the chat that we've had greatly. So the next webinar will take place on Friday the 23rd, again, together with yourself. And everybody, you'll be receiving information about this webinar within shortly. If you have ideas on things that you'd like us to cover, don't hesitate to shoot them out to us to hello@waroncancer.com. So hello@waroncancer.com. Feel free to shoot out suggestions on topics, or if you wanted to deep dive into something that we have discussed already. So remember, we are doing this to provide you, our viewers, with tools to better cope and to better go through what you currently are experiencing. And with that said, big thanks for everybody that came. This was the first time we had this live event or webinar. Also, if you have feedback, please shoot that out to us as well, to the same email address. And with that, I want to say goodbye to everybody, and thank you, Dag, for being here. I look forward to our next chat in, 10 days?
Yes, thank you for having me, and thank you to all our listeners.
Thank you. Okay, you have a good one now.
You too.
Bye.
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 Bye.